So we'll get started right now. Again, thank you for joining us this evening to learn more about the Higher Education Act reauthorization, its impact on health profession student debt, and how you can become a powerful advocate for yourself and the health profession student community to impact federal policy-making decisions that affect your future. My name is Judith Mun, and I'm the Government Relations Manager at the American Association of Colleges of Osteopathic Medicine. ACOM represents 31 colleges of osteopathic medicine across the nation, delivering instruction at 46 teaching locations in 31 states. So tonight I'm joined by my colleague, Kendall Mealy from the Physician Assistant Education Association. Kendall?
Thanks, Judith. Hi, everyone. My name is Kendall Mealy, and I am the Manager of Government Relations and Advocacy for the Physician Assistant Education Association, and PAEA represents 199 accredited physician assistant programs across the nation.
Great. So tonight we'll be providing an overview on the importance of the Higher Education Act and its reauthorization, as well as its impact on health profession students. And as PAEA and ACOM are presenting this evening, Kendall and I will provide some perspectives from the osteopathic medical and physician assistant student side on these issues. And then what we're going to do is delve into just some ways that you can make your voice heard on Capitol Hill and have a real say on federal financial aid programs that are critical to your future. So as you may know, HEA is a law that governs federal student aid programs in post-secondary and higher education, and it has to be reauthorized, and that's just a fancy name for continuation of the program every few years by Congress. So before each reauthorization, Congress makes amendments and negotiates changes to this law, which is what's currently happening on Capitol Hill right now. And that said, a few programs that fall under HEA include the Federal Perkins Loan Program, the Federal Direct Grad Plus Program, the Public Service Loan Forgiveness Program, and also being negotiated are student loan interest rates. And I mention these particular programs because most health profession students depend on them to finance their education. And as these and other programs are currently being negotiated, it is so critical that your voice is heard to federal policymakers on crucial programs that impact your future. So this brings us to why HEA matters to you. Financial health and security indefinitely impacts your future, and it essentially impacts your livelihood. And across the whole board, about 30% of individuals have voiced that student loan debt repayment is the most challenging financial obligation that they have. And provided how large student loan debt can be, many have had to put a hold on what could have otherwise become a real positive milestone in their lives. And this ranges from making large purchases like buying a car or a house or even starting a family. And this is why it's absolutely imperative that at this time when Congress negotiates HEA, health profession students come together collectively to ensure that lawmakers have a real firm understanding about how these programs impact your future. And as you may know, health profession students graduate with relatively high debt compared to students in other graduate programs. And from the osteopathic medical student experience, recent graduates have reported an average debt of almost $230,000. However, we're aware that many other health profession students graduate with higher debt. And unlike other career paths, this immense debt burden is compounded by years of residency training required for certain disciplines of practice. And as a result, health profession students often expect total repayment to exceed at least 2 to 3 times the amount borrowed, and that is huge. And just to add to that, most health profession students enter school with debt from the undergraduate education, and along with residency training, this further exacerbates their total debt. And Kendall, I'll hand it over to you.
Thanks, Judith. So another implication of student debt is the effect it has on choosing a practice specialty choice. We know now there is a high demand for primary care services as the population ages and requires more health care service as formerly uninsured patients gain access. So amidst this rapidly evolving healthcare climate, we need qualified healthcare providers to meet the demand of patients. So according to the National Commission on the Certification of PAs, 19% of recently certified PAs indicate that educational debt influenced their decision to seek a primary care or non-primary care position. With the increasing demand for primary care, federal programs could help lessen the burden of educational debt, which include loan forgiveness, loan repayment opportunities, and also lowered interest rates. Additionally, the Stafford Loan Program does not cover the cost of graduate education for most health professions. As many students utilize Stafford loans during their undergraduate education, as Judith alluded to, they are often close to the lifetime borrowing limit for the Stafford Loan Program. Therefore, students are forced to use other borrowing services. As you'll hear from Judith shortly, assuring that graduate health profession students have continued access to Grad Plus loans with unrestricted caps is crucial to removing undue financial burden on students, and therefore allowing students to make a specialty choice based on preference, not out of necessity to pay back student loans. And with that, I will turn it back to Judith.
Awesome. Thanks, Kendall. So if you aren't already, by the time we're done with this webinar, I hope you will be done with that, because I surely am. And as I mentioned before, each reauthorization of HCA provides a real golden opportunity for us to further highlight to Congress the distinct aspects of the health profession student community, particularly the significant debt burdens of health profession students. In other words, right now is very timely for you and for the whole health profession student community to come together and tell Congress that you are done with debt. And that's why your voice is key to impact the decision-making process on federal programs that impact your future. We all need to come together as a community to urge Congress to protect your financial future by lowering interest rate caps, preserving Grad Plus and other programs, and maintaining loan repayment and forgiveness programs. And let me just briefly delve into some of the issues and programs during HCA negotiations that really just affect health profession students, one being federal student loan interest rates. And just to provide you some background information, there was a piece of legislation that was passed about 3 years ago called the Bipartisan Student Loan Certainty Act that aimed to address higher education issues overall, including federal student loans. So what it essentially did was tie the interest rates to the market, which, as you know, fluctuates. So when students take out new loans, they can have different interest rates because loans are tied to the market. And this means at the end of the day that there's no consistency or predictability on loans students take out. The bill that was passed 3 years ago also capped grad student interest rates at 9.5% for federal Stafford loans and 10.5% for Grad Plus loans. And interest rates are projected to reach caps in 7 to 8 years, which nearly doubles the amount of interest that a student has to repay. So this all means at the end of the day that if you don't speak up now and tell Congress to make necessary changes to lower the graduate student interest rates, they can continue to climb and further exacerbate student loan debt for graduate and health profession students. And Grad Plus is another program that falls into HCA that's critical to health profession students. So Grad Plus loans, if you're not already aware, are comparably low interest federal loans available for graduate and health profession students who need more than the maximum federal Stafford loan amount of almost $21,000 to cover educational expenses. And just to illustrate for you the importance of the Grad Plus program, particularly to osteopathic medical students, let me just throw out a very compelling stat. So nearly 70% of graduating osteopathic medical students reported having a Grad Plus loan with a mean loan debt of almost $90,000. And without these loans, it'll be really devastating for health profession students since Grad Plus helps supplement the full cost of their education. And provided the importance of the Grad Plus program, it's really crucial for us to urge Congress to not limit the borrowing of these loans, as doing so will essentially create even greater financial hardships for health profession students, and this could potentially also mean limiting access to their education. As you may know, there are a variety of federal loan repayment and forgiveness programs under HCA. And one example that we'll provide here is a Public Service Loan Forgiveness Program, or PSLs, which basically incentivizes healthcare professionals and those in other professions to enter into public service in exchange for loan forgiveness. So PSLs in particular encourages healthcare professionals to serve in rural and other underserved areas, which is critical considering a health profession workforce shortage in these particular areas. And currently, as it stands, PSLF provides full forgiveness after service is rendered, but PSLF has been proposed to be capped at $57,500. You know, the whole point of this program is to incentivize healthcare professionals to enter into public service, especially in rural and underserved areas. So by limiting the loan forgiveness amount could severely decrease the number of future healthcare professionals participating in this program. So now that you've heard about some important issues impacting your future, Kendall and I will delve into a few ways you can become engaged at different levels and use your voice as a powerful tool to advocate for yourself and for your peers in the health profession student community. So the key to making our voices heard is to ensure that we all stay engaged. And staying engaged comes at varying levels. Now, if you take a look at your screen, you'll see a graph of a really interesting man with 4 arms. And he's essentially a slacktivist. And so I'm not sure if you heard of the term slacktivist, but as you may have guessed, it's a hybrid of the words slacker and activist. And slacktivists are folks who do something in support of an issue or cause that requires minimal personal effort. And this could mean just simply retweeting a message, encouraging others to sign a petition, or partaking in a trending event like last year's ALS Ice Bucket Challenge, which highlighted the issue to the public even more. And the point here is that there are advocates at every level of activism. And slacktivists are just as crucial to advocacy and spreading awareness of an issue to help get the conversation started. The social media is the fastest and has been progressively more effective in spreading messages and just getting conversations both on and offline started. And that's exactly what we want with this. So whether you consider yourself a slacktivist or not, activists at every level utilize social media, but it's only effective if you utilize it to make yourself heard. So for example, Twitter has dramatically been adopted by Congress over the years because so much of the information around Internet and DC are just, it's a mess with the 24/7 news cycles and just news running back to back. And Twitter provides a platform to share information in a real quick and easily digestible way. Many members of Congress have even stated that Twitter has made them more accountable to the constituents, and it enables members of Congress and their staff to have more frequent, even timely, and more meaningful interactions with their constituents. And to further bring this point home, you'll see on the chart on your screen that Hill staffers use Twitter at least once a day. And another interesting finding is that over 70% of Hill staffers have stated that social media comments directed to members of Congress by multiple constituents affiliated with one specific group or cause could have an influence on an undecided member of Congress. And this just goes to show how a community's voice is that much more powerful and influential. And utilizing social media as a way to channel it is a pretty effective tool. Now, I'll just hand it over to Kendall to talk about other ways to get out there and advocate.
Great. Thank you, Judith. So taking action. Judith has spent a good amount of time laying out the issues, and so now we're going to give you some tangible things that you can do to really engage your members of Congress and be powerful advocates. So the first thing, I'm sure many of you are familiar with action alerts that I know PAEA sends, I know ACOM sends, and other health professions organizations as well that ask you to contact your member of Congress on a specific issue. I know this might seem like spam mail, but it's really not, and these are wonderful and powerful tools to get your legislator to know where you stand on a specific issue. So this might be a good opportunity for those slacktivists, as Judith talked to just really, click a button and it goes directly. It's a pre-populated form that allows you to customize most of the time that will send directly to your congressional representative's office. So again, take action alerts are very powerful, so when we send them out, please pay close attention to those. And aside from action alerts, another way to be involved is to send a letter directly to your member of Congress. Utilize their website or their contact forms that are a lot of times on their website, or contact your local government relations staff. I know ACOM and PAEA and other health professions, GR staff that we work with are wonderful, and we'll be more than willing to give you correct email addresses to have you send letters directly to your congressional representatives. Another way to be involved is to just make a phone call. So call your member's office to relay your thoughts and opinions on issues. Pick up the phone and say, hey, Senator so-and-so, I am really thankful for your support of Bill X, Y, and Z. And that's, again, just another powerful tool to let them know how you stand on a specific issue. And it also creates a groundswell. So can you imagine how powerful it would be if hundreds of health profession students were calling Congress at the same time, asking the Hill to say they're done with debt? I mean, that's a powerful movement there. So again, a phone call is another great idea. Events are also important. So taking a look at local events that might be happening in the district. So town halls, I know election season well, we're in the midst of election season, so members are often holding events. They want to be out. They want to be visible. So take a look at the calendar and see what's going on locally in your district when your member's back in town, and take advantage of that. It's a great opportunity to interface with your elected officials and maybe get their ear for a few minutes to talk about these important issues such as student debt. In all of these action strategies, the most important thing to remember is to tell your story. So as a health profession student, you have a compelling case to make and can speak really firsthand to the issue on student debt. I know sometimes the policy behind a lot of these initiatives might be a little bit wonky and can be very complex, but your job is to talk about your role as a student and as a future practitioner and describe how student debt has impacted you personally and will continue to impact you as you begin your career in practice. So on the next slide, we'll finish with a few tips on how to get involved and stay active. So I talked about creating a groundswell, and it's really important that you keep the conversation going in your own programs, in your institutions, at your medical schools, at your PA programs. Talk about these issues amongst your peers. So you're on this call today. Obviously, you're invested in the process. You're a leader and obviously care about those issues of student debt, but take it back to your program. Talk with your other students and say, hey, student debt really is a big issue. What can we do locally to elevate and heighten this issue? The next thing would be to meet with your legislators in their district offices. So similar to finding those events that might be in the works in the district, if you can't get to Washington, then they have district offices. So contact district staff and say, hi, when the member is in the office or when back in the district, we'd love to come to the office to meet with you to talk about a few issues. Or we would love for you to come attend our white coat ceremony. Invite them to your institution. Invite them to speak at, maybe you have a special ceremony or a graduation. Inviting lawmakers to your school so they can see firsthand the value of education you're receiving is another powerful tool that you can use in your advocacy. And with that, I will turn it back to you, Judith.
Great. Those were additional pretty awesome ways to get more involved and get your voice out there. So thanks, Kendall. So if you aren't already following us on social media and you'd like to be more informed and connected about the issues that Kendall and I discussed earlier today that impact the health profession student community, you can follow us. Follow ACOM and PAEA on Twitter and Facebook, and on your screen you will see ways to connect with us via social media. And of course, our contact information will be available at the end of the presentation. So if you have any questions or comments that you think of after the webinar, please reach out to us, and we'd be happy to work with you on that. Alrighty. So it looks like the flow of questions have stopped, and we really appreciate those that participated just for being on this call and to ask these really great questions that you had to be more involved. I know Kendall and I, and our teams, we are here for you here in DC, advocating on your behalf. But again, in terms of the bottom line and the message that we want to get out to you all is your voice really matters, and that's what members of Congress, and essentially folks who make decisions on policies that impact your future, they want to hear from you. So again, Kendall's information as well as mine. It's up on your screen, so please take note of that. And if you have absolutely any other questions or further feedback, just please feel free to give us a call or email us. Thank you so much and have a great night.
Thanks, everyone.